Hi, I'm Dr. Greg Jantz. As a counselor and founder at the Center, A Place of Hope, I want to talk just a minute about obsessive-compulsive disorder, OCD, in the workplace, where you work. And if you struggle with this, or you may have a coworker and you're wondering, is it OCD? Here's how we look at OCD in a professional setting. Number one, perfectionism, over perfectionism, and a fear of making mistakes. It can freeze you. You may see a lot of jobs just not getting done or done timely, and the level of anxiety can be quite high. You can be constantly checking emails over and over and over for approval, or you've reread the same report a dozen times and it looks great, but you're making sure that it is beyond perfect. The other area I've made a note of, repetitive behaviors and checking. This is a rewriting of things. It's nothing is ever good enough. So think of perfectionism, fear of making mistakes, and then you're ruminating. You're going over and over things. And this brings us to number 3, which is the intrusive thoughts that just are so powerful, and it affects your focus. Those intrusive thoughts cause you just to lose focus, and it really will impact our productivity. We do know that you can be thinking about, if I don't do this just right, something really bad's going to happen. And that's what it feels like over and over and over. All right. The next one we want to look at is relationship challenges. If I have OCD in the workplace, I may have a great difficulty trusting my colleagues just to complete a task. I may be ultra sensitive to any kind of criticism or anything that feels like criticism. I can be hyper sensitive. All right. Now, here's what happens. You get burned out. Your productivity drops. There's strained workplace relationships. And then it just kind of puts this career lid or limitations on us, where we just feel like I can't go anywhere, do anything, and I just kind of stop seeing myself as achieving or productive. Here's how we can manage this in the workplace. This is important. You can use the tools of cognitive behavioral therapy, CBT. And it really can help you retrain thoughts. This is, you can learn a lot about this even by working on, there's some great workbooks, obviously a counselor that can train and teach you in CBT, and I'm going to add DBT. Where we're able to learn different skills. There's a skill called distress tolerance, where I learned I can handle a lot more than I thought I could. But these are skills that are taught. All right. Workplace adjustments. Sometimes we need to have an accommodation where we even reset. Maybe we have the help of a supervisor, but we reset realistic expectations, and we use different way of tracking our work, different goal sheets, where I only spend so much time on this particular project, and then I pass it on. Okay, those are hard to do sometimes. There's the importance of just open communication. I can tell you most HR departments have not only dealt with this, but they're used to assisting even with accommodations. I think there's a time where, if this has been going on, and you can relate to what I'm talking about, there's a time where I need to up my intervention. I can work with a counselor that really understands OCD, and there's a lot I can practice on my own, by the way. But at times, like the work we do here at the Center, A Place of Hope, there is an important opportunity that I can take a period of time, maybe it's a medical leave, and I can get in and do something more intensively that gets down to the core issues, down to the root causes, to deal with that obsessive compulsive disorder. And here's what I know, because it's a common issue we deal with. You can live differently. It can be helped, and there is help. Take one of the tests, aplaceofhope.com. Take the test there. Go to the website, A Place of Hope. Take, I believe upper right is a tab that says test. There's really a good one that you can take on our topic today of obsessive compulsive disorder. Use today to begin to take some steps towards some recovery.